Hi class. My intent in this recording is to talk briefly about some clinical conditions that are associated with some abnormalities in bone growth. The first one I want to talk about is conditions that are associated with excess growth hormone. So growth hormone is a hormone needed for normal growth, including bone growth. So if you overproduce growth hormone as a child, so before the epiphyseal plates have closed, is you will have gigantism. So if you look at this kid, that's a giant kid. So they have a excess linear bone growth. If you overproduce growth hormone as an adult after the epiphyseal plates have closed, you're not going to get any taller than you were, but what you'll have is the increased appositional growth. So you start to see certain things where they get a little bit more growth in the hands and the feet, the jaw. I always think, and then they also there's, if you ever look up something called Cro-Magnon man, they have this kind of what's the word, like that bone up in the front part of their head. They just have some abnormalities in excess appositional growth. There's other issues that these people have, but those when we're talking about bones. If you hyposecrete growth hormone as a child, you can end up having dwarfism. There's many causes of dwarfism, but it can the stature would be very, very small if you hyposecrete growth hormone. But these two are hypersecretion. So this one they refer to as acromegaly, where you hypersecrete it as an adult. Gigantism is what you have if you as a child. Another thing I want to mention, I previously mentioned it before, is this is from the lab that I worked in when I did my postdoc. Is one of the fellows, Eric Fellner. He was seeing some patients over in the endocrine clinic. I was in pediatric endocrinology, and he noticed a number of patients coming in, children, boys, I should say, that were exhibiting gynecomastia. And these were very young children, so in their males, is you shouldn't see breast growth in young males. And it was actually because of what was this common thing was the mothers were going through menopause. They were having menopausal symptoms, and they chose to use estrogen creams. Thing is, estrogen creams, when they're on your skin, you can transfer them to other people if you touch them. And of course, these are young children. The mothers are picking them up and holding them and all that, and so they were transferring the estrogens to the males. And so there was what was more obvious to the mother was the development of the breast in them. The problem, though, the biggest issue with that they're concerned about is advanced bone age, so changes in growth. The concern is if they get exposure to estrogens too early in bone development, they can have premature closure of the epiphyseal plates, and those children will never get to their true height. So that was the big, the public health issue, is to educate mothers that are having children later in life and then going through menopause. You should use another delivery method for estrogen replacement and not use creams. A other thing I want to mention is the role of thyroid hormones in bone growth. Thyroid hormones are needed for a number of different body systems in your body. It targets virtually every cell in your body. It affects your metabolism, your basal metabolic rate, but it also affects your bone. And this gentleman right here, it looks like he's a dwarf, but this is not. Is not a dwarf because he has underproduced growth hormone. He has cretinism. And cretinism is when you don't have sufficient thyroid hormones as a child, and the children will be born with skeletal deformities and deficits, and it can affect your brain function. But children that are born with cretinism, if they get thyroid hormone replacement early on, it could affect end up so they don't have as delayed mental abilities. But this gentleman obviously has issues with, he's very, very small in stature, and it was actually because of not having sufficient levels of thyroid hormones when in development within his mother as well as after birth. Now here, this one is talking about hyperthyroidism. If you overproduce thyroid hormones, it can increase the turnover of bone. It's needed just for normal bone turnover. The thing is, if you have elevated turnover of bone and you don't match it with synthesis, you'll end up with bone loss and you can end up with osteoporosis. So anybody that's had episodes of being hyperthyroid, their chances of being osteoporotic go way, way up. Other one I want to mention is vitamin D and vitamin D deficiency. So vitamin D deficiency in a child leads to what we call rickets. In an adult, this here is an adult, it leads to osteomalacia. It'll mean softening of the bones. So what happens is if you don't have enough vitamin D is needed to absorb calcium. Calcium makes bones very strong. Well, if they don't have enough calcium because they don't have sufficient amounts of vitamin D, the bones are not as hard, they're softer. And so as the child's growing, the weight is the legs can't bear the weight of the child, and so they bow out. Now this is a dog. Dogs can get this too with rickets. So you see his legs are bowing out. Now an adult, when it happens in an adult, we can get this right here. It starts to soften, and the vitamin D deficiency in adults can lead to osteomalacia. So both of these are bone deformities, and it's a result of insufficient levels of vitamin D. All right, so that, actually, I'll just show you a picture before I do that. This is showing you a scanning electron micrograph of normal bone, spongy bone, which is trabecular bone. And then here's it in someone with osteoporosis. So look at all these little holes here. So the bones become very, very brittle, and they break very easily. And this can happen in us as we age. That can be a result of it. Not getting sufficient levels of calcium or vitamin D, that also can happen too. But this is all I wanted to cover for some of the clinical conditions.